Do you know that about 12% of all women experience episodic or chronic, very painful migraine headaches? Hello, I'm Dr. Paul Wylie, neuropsychiatry and sleep medicine specialist and the medical director of Preferred Research Partners. In this episode of Hope in the Pipeline, we will dive into the topic of menstrual migraines and how volunteering to participate in a local clinical research trial testing a new treatment for menstrual migraines might be a benefit to you now and can be a big key to helping others have access to better treatments in the future. I mentioned earlier that 12% of women experience common migraine headaches. Well, 60% of women who are currently having menstrual periods and experience common migraines report that some or most of their migraines happen around the time of their menstrual cycle. Menstrual migraines are caused by changes in the level of the hormone estrogen that takes place monthly around the time of onset of the menstrual cycle. In general, levels of estrogen and progesterone are lower than normal prior to the start of the menstrual flow, but fluctuate over the course of the entire menstrual cycle, particularly at the time of ovulation. The drop in hormone levels and the subsequent fluctuations can cause migraine headaches in some women. Menstrual migraine headaches are most commonly one-sided and can get worse with movement or exposure to light, smells, or sounds. The migraine headache may last for a few hours, but can sometimes last for up to 3 days. Menstrual headaches are often more severe than other types of migraine headaches. The pain is often described as pulsating or throbbing in nature. Other symptoms of a menstrual migraine include sensitivity to light, sound, and smells, a tender or sore scalp, loss of appetite and dizziness, blurred vision, feeling tired, nausea and vomiting, abdominal pain, and sweats or chills. In general, menstrual migraines can start up to 5 days or so before the onset of the menstrual cycle, during the menstrual cycle, or within a day or two after the menstrual cycle ends. Menstrual migraines can sometimes worsen in response to being on birth control pills or hormone replacement therapy. But conversely, adjustment of hormone pills to eliminate or reduce the placebo time can sometimes be helpful in terms of treatment. However, use of oral contraceptives at higher doses carries some increased risks, such as an increased risk for blood clots. There's often a genetic familial predisposition to having menstrual migraines, so it might be a good idea to ask the question, what medication has my close family member responded well to for treatment of their menstrual migraines? Menstrual migraine pain can be severely limiting to the desire to engage in activities during a time of the month when the desire for participation in activities may already be limited. It's often helpful to both you and your healthcare provider if you keep a migraine journal, a record of when your migraine headaches begin, peak, and end, in particular related to your menstrual cycle. Take note of what symptoms you have, how long your symptoms last, and what makes your migraine headaches better or worse. There are already some medications available to treat common migraines. For example, the anti-seizure medications topiramate and valproate, the antidepressants amitriptyline and venlafaxine, and the antihypertensive propranolol. And some patients benefit from use of vitamin E or magnesium or a nonsteroidal anti-inflammatory medication such as Aleve for treatment of their menstrual migraines. Now, more recently, the triptan medications have been used effectively for treatment of common migraines and have been used for menstrual migraines. But these medications can cause drowsiness and fatigue and the need to nap after taking them. So the activity limitation from having a headache really isn't improved if your activity is limited from the medication being sedating. Finally, about 42% of people fail to respond to treatment with triptans. I am pleased to report that at Preferred Research Partners, we are currently privileged to serve as a site for AbbVie Pharmaceutical Company to test a medication already FDA-approved for treatment of common migraines, specifically for use in women for the treatment of menstrual migraines. This medication needs only to be taken about 7 days a month and is intended to prevent a menstrual migraine from ever occurring, rather than being taken only after a bad headache has already started. As a physician, I would rather prevent suffering than respond to it after the fact, and I would rather take a medication that treats my pain but doesn't leave me feeling foggy, drowsy, and still impaired. We are currently looking for individuals ages 18 years and up who either know that they suffer from menstrual period migraines or think that they might have menstrual-related migraines to further test the effectiveness and safety of this new medication. This is a paid clinical trial lasting 18 weeks, followed by the opportunity to be in a 1-year-long extension study and receive free medication during that 1-year time if there was benefit to the headaches during the initial treatment period. If you or a loved one or a friend knows someone who has or might have menstrual migraines and think that they might be interested in exploring the possibility of joining this clinical trial, please check out our website or direct them to our website at www.preferredresearchpartners.com to learn more about this study. As always, please like, rate, and review my podcast, which helps more people to find it and to learn from the content. If you know someone who you think might benefit from viewing this podcast episode, please share it with them. As always, thanks so much for listening to today's Hope in the Pipeline, and we'll see you again next time when we talk about the relationship between obstructive sleep apnea and high blood pressure.